are leaving on Thursday, right? So this is Mr. Victor Soa Abordo. He is currently in charge of the archive. You meet our colleagues. I'm calling them our colleagues because we are doing the same work. And it's civil registration, ensuring that we have good quality data for policy formulation.
Keep all deaths
1929.
recorded in the country, and it started from 1910.
1910.
Yeah, starting from 1910. And I think the last time we checked on this one, so that's how the records were kept by then.
Yeah. Look at the causes of death: acute bronchitis.
Yeah.
What are some of the
What's
causes?
that one? Senile decay. That's brilliant.
And do they have the age of death anywhere?
Yes, they do.
Yeah, they have the age of death. It will be very good if you can capture this information. When you look at the trend from the 1910s up to now, you realize that they are mostly similar causes of death that we are facing now. It hasn't changed too much.
Just the terminology.
Malaria is still killing people here. You still get this information. So it looks like we have to look at that particular data very well, analyze it, and then know what we will have to do.
So
Have you ever had a historian or students of history come here to look at that question?
It's not that open to academic research unless you seek authority from.
But no one has sought
And
that.
then no one has, no. Normally they come for birth records.
So no one's taken all of those data and sort of pulled them or looked at them? Oh, probably you'll have to do that.
And are they organised by region of Ghana?
Yes, they are organized by region. This is Accra. We have Ashanti region at the back because of space, office space. We're trying to keep them in order at least, but arrange them in
If I'll add to that, they are organized by registry, district, region.
Maybe they are carrying the sickness from one jurisdiction to
Generation,
the other.
genealogical, some
So you'll be able to trace
genealogical,
the
some-
cause
Following them.
and the area where it's coming from.
Oh, so
Are
much
these
information.
all deaths that would have occurred in hospitals or health facilities, or would they be also include deaths that occurred at home? And
Most of them occurred in hospitals, but majority of them in houses.
in Australia, since 1948, there are electronic records of cause of death, or it's been, but not before. But there are, the Australian Bureau of Statistics has these books going back to 1908, and so I paid the Australian Bureau of Statistics to have someone digitise the causes of death by age and sex in Australia every year from 1908 to 1947. And then from 1948 onwards. So we have now an electronic database in Australia all the way back to 1908. And this has been very useful for research because we have studied, exactly as you said, the things that were killing people many years ago are still killing people, but they're killing them in different ways and different proportions. And you can trace these epidemiological transitions. It would be an extraordinary contribution to public health in Ghana. You only need the age, the sex, the location and the cause of death. You could do so much good.
There have been a few interventions in digitizing some of the records, but most of the partners are interested in child protection, so they are interested in the birth record. Forgetting death record is playing a critical role in the living. Because once you can ascertain the causes of death, you help the living live a better lives and live longer. Very critical.
This is an extraordinarily valuable resource. You have a very important role in life too.
It's more than just numbers, this is people.